prohibition of classroom instruction of sexual orientation and gender identity. That was originally K-3. It's been expanded through from pre-K now to 8th grade. And then outlines specifically that any instruction in 9-12 be age and developmentally appropriate. And then also it adds requirements that district posts on their websites and policies that they have adopted for parental notification procedures. And then this is also the House bill, whereas previously last year school boards approved the reproductive health and disease education supplemental health curriculum. It removes that piece, and now it will have to be approved by the Department of Education. And then also, it just includes once again library materials being included. That includes individual libraries, and that each district has an objection form. So the Department of Education will be providing a constant objective form for all 67 school districts.
The next piece I'll add that this bill will impact the student support guide, and so we will have that updated prior to the start of the new school year. And then I guess Paula's piece about that the legislation could impact board policies related to curriculum and instruction.
Yeah.
Board Member Hershey.
If you would go back to the previous slide, and I think it was that middle bullet that says removes all school board authority over the curriculum. So does that mean, I just want to clarify, the way I understand it is that means going forward, any curriculum that addresses reproductive health is decided by the Department of Education, and there's no board discussion over that. I just want to,
So it is approved by the Department of Education.
Does that include books? I'm just thinking about speakers. We've had a lot of speakers who like to
Any
address the board on
materials,
this.
any materials that's addressing reproductive health and disease education.
So
That teaches, yes.
the teachers, so we would not even be approving the textbook that's just coming down from the state, and they're
Right, so the supplemental materials that would come, that approval would then now come from the state.
and so I just really clarifying, because I don't know about you, but I heard a whole lot of that this past year for public input and conversation and that kind of stuff. So just to be clear that going forward, none of that is really coming before the board to vote on and make a decision when it's just coming from the state.
That is correct.
Okay.
So the meeting we normally have, I'll go one more time, to do that, we no longer are required by law to have because it's unnecessary.
To the chair, that's correct.
So we have a lot of people watching. I would just want to make sure, and most of them will expect that would happen. So I had actually,
though, you do have to approve all instructional materials.
right, no, I just
And we
meant
have to
as,
submit that.
yeah, I just meant as it relates to that. I actually had Board Member Willie first, and then I'll come right over to you.
Yeah, I was just gonna through the chair to say the same thing. This is so much overreach right here. I mean, the fact that we can't even pick our own curriculum locally, understanding, because the whole issue that we had before was our data and what our students need may be very different than some of the other 60 some odd counties that are around. So yes, this may sound good to certain folks, but for me, this is dangerous. It's a slippery slope, and it takes power from this table right here, which we are duly elected here in this city to look out for our community and our kids and our families. And this doesn't do that. This takes it strips it away. And if they can do that right here, then who knows what else they can start to do or will continue to do. I just want to make that statement.
Board Member Joyce.
So supplemental materials for health is approved by the board every year. I just want to understand the process. So is the board the district creates something, the district wants to use a particular supplemental material, is it submitted to the district, to the Department of Education? Does the Department of Education have a list and this is the approved materials? I just wanna know, what does that look like? Because as a board member, we wanna know what our students are utilizing or what they're using as supplemental materials. So how is the district going to comply with this piece?
I believe they're in the process of rulemaking right now, and so we don't know whether they're going to send us the list of things that we're going to use or we can choose from, or if we have to send it up to be approved.
We're waiting guidance.
I'm looking forward to understanding the whole. Thank you.
Alright. Keep moving. So House Bill 1537, this was a big one as